Well, hello, everyone, and I regret that the conversation that we're having has to stop momentarily, and I hope you will continue your lunch while we proceed with our program. I do want to welcome you. It's good to see all of you. Many of you are our friends and colleagues in the effort to improve housing in this country. My name is Tom Vernon. I have the honor and the good fortune of being the chair of the board of the National Center for Healthy Housing. Good fortune because it's a terrific organization, as many of you know who work with it, an organization that over the last 2 decades has made many contributions, often working with many of you toward the improvement of the state of housing and safety in our country. All of us here, I think, are well aware of the documented evidence of the significant consequences of housing on our health and our lifespan. We know only too well how poor quality housing in blighted neighborhoods leads to shortened lifespan compared with more much better housing. We know it diminishes property values, it increases crime, and it erodes the political power of communities. But there are several facts which are unhappy ones for us. One is that a lot of people, including policy leaders, don't know about the consequences of the housing to our health. 2, the fact that we set a goal in Healthy People 2010 to achieve a 52% improvement in substandard housing and have made no progress. And the sum of it is that we in the U.S. are investing not commensurately to the importance of the problem in our lives and our health. So whether it's lead poisoning, asthma, radon-related cancer, injuries, or other, we are affected by the house in which we live. A salient example is the penalty for life, especially in urban America today, of low-level lead exposure. We, with new studies accumulating today, are compounding the evidence that we have had for decades that lead poisoning leads to failure to learn, it leads to behavioral problems. And the studies that are coming forth, tracking low-level lead to failure to learn, are very distressing in terms of the lower lead levels, which are leading to this blight on life for children, particularly in urban America. Now, we're rightly proud of the striking reduction that has been made in the mean blood lead level of all American children. But the unhappy exception is in too many of our urban areas, like my hometown in Philadelphia, where mean blood lead levels are 4 to 6 times the new mean for all of American children. And 1/3 or more of children enter school with a history of lead poisoning. You know these facts. And you know the facts about school absences that are due to asthma triggers in homes. You know about the radon associations with as many as 20,000 or more lung cancer cases per year. For 2 decades then, the Center has been a key organization working to solve problems and to find practical approaches to fixing those problems. We train thousands of practitioners in how to find, to assess, and to fix hazards in homes. We advocate for policies and programs at the local level, at the federal level, in order to improve quality. A lead way in which this is done is the National Safe and Healthy Housing Coalition of 150 organizations, and many of you are part of that coalition. We conduct research on important and practical changes that you can make to homes to keep them safe and healthy. For example, we've studied the impact of green building and energy efficiency measures on the health of inhabitants. And our future research will look at the impact of neighborhoods on health. And very important to us is that our research underpins all of our policy advocacy, including the National Healthy Housing Standard, which we are unveiling today. Well, I want to say that there is good news. It ain't it awful. We simply need to muster the political will and the financial resources that are put before the people who have the power with the best scientific information about how to improve health. I want to take a moment to thank our technical committee who have put so much effort into this undertaking. Many of them are national and international experts who could not be with us today, but they deserve a great deal of appreciation as well as recognition. And I also want to thank our national committee, which is the committee which oversaw the effort and thought through plans for the dissemination and the adoption of this new standard. And finally, I do want to thank all of you here who are our friends and colleagues in the housing movement, in improving the substandard housing of America. Next, I want to introduce our next two speakers. First is my friend and colleague, Dr. Georges Benjamin, President of the American Public Health Association, and then our esteemed National Center for Healthy Housing Executive Director, Rebecca Morley. Dr. Benjamin has been the Executive Director of the American Public Health Association since 2002. He has many recognitions as an influential executive and public health leader, including voted among the 100 most influential people in healthcare from 2007 to 2013. Dr. Benjamin was previously the Health Secretary of the state of Maryland. He's board certified in internal medicine and a fellow of the American College of Physicians. Georges started his postgraduate medical career in the U.S. Army Medical Corps. He served at Walter Reed as Chief of Emergency Medicine. After leaving the military, he chaired the Department of Community Health and Ambulatory Care at the D.C. General Hospital, and he was promoted to acting commissioner for public health in the district subsequently. He later directed one of the busiest ambulance services in the nation under the District of Columbia Fire Department. As is so often the case with someone like George, who has accomplished a lot, he's also written a lot, like over 100 articles and book chapters. He has a recent book called The Quest for Health Reform, a Satirical History. And it's something I look forward to seeing because it's in essence a compilation of cartoons along with text which talk about this 100-year quest for health reform in America. Rebecca Morley has been our executive director at the National Center since 2002. Among her many leadership accomplishments are the leadership of the National Healthy Homes Training Center, which is now active in 40 states. She spearheaded the National Center's work after Katrina and Rita in the Gulf Coast. She launched and served as chair of the National Safe and Healthy Housing Coalition, which I mentioned earlier. And she has been the driving spirit behind the collaboration with APHA for this national standard. Rebecca holds a master's degree in environmental science and an undergraduate degree in environmental science and subsequently a master's degree in public policy from Georgia Tech. She was a senior consultant with ICF for a period of time, and she was a HUD Presidential Management Fellow working in several offices at HUD, including the offices of the Secretary, Public Affairs, General Counsel, and other. And she also served on the President's Task Force for Children's Environmental Health and Safety. Rebecca, at one point, served as a legislative fellow for U.S. Senator Jack Reed. As you might assume, there's a great deal more that can be said about both of them, but better that you have the time with them, and I'd like to ask Dr. Benjamin to come up to the podium.
Thanks, Tom. You know, obviously, we are pleased to collaborate with our friends at the National Center for Healthy Housing on the development of this standard. In fact, the American Public Health Association has a long history setting minimum standards for healthy housing. In the year of my birth, in 1952, APH published the first model housing ordinance. Year of my birth, I like that. In 1939, the Basic Principles of Healthy Housing was also published. Now, actually, the inspiration and basis for the standard that we're releasing today is based on a 1986 document by APHA and the United States Center for Disease Control and Prevention, Housing and Health, recommended minimum housing standards. And so in many ways, this is an update, an intensive update of those standards. Now, APHA believes in the health in all policy approach. So that means we strongly believe that housing is public health. Now, our homes are intended to shelter us from the elements. It's supposed to provide privacy, a place to respite, and to ensure our safety from the outside world. In most places, homes are safe and healthful havens, largely due to the protective regulations put in place over a century ago. Yet in many communities, housing regulations have neither kept pace with the way Americans interact with their homes, nor with the modern diseases that plague society today. And that includes the chronic diseases such as asthma and depression and cancer, and the national plague of epidemics of injury. As many of you know, housing standards were born in this century in the early 20th century. At that time, growing concern about the total infectious diseases such as tuberculosis, typhoid, and dysentery in America spurred a national public health movement aimed at eradicating inadequate housing conditions, obviously conditions of confinement. And that effort yielded important housing improvements that dramatically curbed the outbreak of communicable diseases. And in the decades that followed, the public health community became less involved with housing as separate government departments were established to develop and enforce housing and building codes, i.e. the magical schism between public health and housing. Now, this separation of public health and housing has challenged the nation's ability to mount a successful campaign to improve the quality of housing and our neighborhoods. The consequences of not dealing with substandard housing are dire in both human well-being and cost. And of course, think of the risk of unhealthy housing, I think, in four broad preventable areas: respiratory disease, cancer, toxins, and injury. And for example, you heard some of that from Tom, talked about the up to 30% of asthma cases are linked to home environmental conditions. The over 21,000 lung cancer deaths that result from radon in our homes each year. The over 24 million homes that have lead-based paint hazards, which put children at risk for irreversible disease of childhood. And the real challenge here, of course, is the challenges that it creates for those kids in their schools. As a former emergency physician, I would be remiss without talking about home injuries as a leading cause of death for young children, and a cause for over 6 million adults over the age of 65 in hospitals and nursing homes due to preventable falls. Falls are not inevitable. They absolutely are preventable, and we can build our homes to address that tragedy. So on behalf of the American Public Health Association, I thank all of you for your involvement and investment in our nation's health. With that, I'd like to have Rebecca come up and make some comments. Rebecca.
Speaking of preventable injuries, thank you for helping me up there. So welcome, everyone. So nice to see so many friendly faces, familiar faces, partners and friends. I wanted to just talk very briefly about what is the standard. So I think by now you're probably asking yourself exactly what is this document and why am I here? And so hopefully I can answer those questions quickly. I want to also first acknowledge my board chairman, and one of the best parts of my job is working with Tom and the rest of my board. Don Ryan is also here. Don, can you stand up so people can see you? And Mark James. And any other board members that I'm missing here? Okay, well, they're just such a delight to work with and so supportive, and they're amazing ambassadors for our mission to create safe and healthy homes. So the standard, just to be clear, is it's a property maintenance policy. It's not a building code. Building codes regulate how you construct new homes or substantially renovate homes. This is a property maintenance policy. It's targeted at the 100 million existing homes that we have out there. We used state-of-the-art evidence and our experts to help us make sure that it reflects everything that we now know about the way that housing affects health. We received over 300 comments on the draft that we put out last June and incorporated changes to reflect those. And when I say we, I mean Jane Malone, our policy director over there. If I could have a round of applause for Jane's Herculean lift on this. Jill Bracey and Dave Jacobs were also key helpers and really provided terrific technical support on that. So there are 7 chapters of this document, and they generally reflect the 7 principles of healthful housing. And you should know the mantra by now, but if you don't, we want to keep homes dry, clean, pest-free, contaminant-free, ventilated, safe, and maintained. Those are the things that we know if we do, we can make a demonstrable difference in the health of and well-being of our population. We've taken great pains not to conflict with existing codes. Existing model codes. Some of you may be aware of the International Property Maintenance Code. It's been adopted by 800 jurisdictions around the country. And in fact, we see that as one opportunity for this code to be adopted during the process. When people adopt the IPMC, they can also adopt this as a stretch or a supplemental code. And I know our friends from the ICC are here today, and I thank you guys so much for your support and partnership. We also were very careful to balance affordability and practicality with public health, because we know that that is a very difficult balance. Right now, people make very difficult choices between having a roof over their head at all and having some quality of home. And we look forward to the many ways that these recommendations will be adopted. I guess the old adage is true, there's no such thing as a free lunch. We do like you, and we wanted to have you here because you're our friends, but we also have a request for you. We want you to go back, we want you to look at this document, and we want you to think about the ways that you can use it within your spheres of influence. The city of Omaha, Nebraska, the state of Massachusetts, Seattle, King County are already looking at this document and ways to incorporate it in changes that they're making to their codes, their housing codes. And I also want to call out especially our friends at the American Society of Home Inspectors, Enterprise, NeighborWorks, Rebuilding Together. These are part of our early adopter community. They have already committed to taking a look at this document and incorporating it into the way that they finance and rehab and repair homes around the country. So thank you for your partnership. So I think collectively we really have tremendous reach. We have the same vulnerable families and individuals that we serve, and this standard really has I think there's a lot to be gained by our clients if the standard is adopted and enforced, and we need your help with that. Without further ado, it is my privilege, and with some anxiety, I have to say this week I've been preparing to introduce my friend and colleague, Henry Cisneros. Henry served on our National Advisory Committee for this standard. He's been a tremendous help. He's so thoughtful and so smart on these things. I think most importantly, though, what strikes me about Henry Cisneros is his experience with these issues really face-to-face. This is a gentleman who's not afraid to get his hands dirty. I read that when you were a city councilman, you helped with the sanitation crews take out the garbage to understand the problems of sanitation in San Antonio. I understand that you stayed overnight in Chicago in the public housing developments there when you were conceptualizing the Hope 6 program. And I know you've slept in homeless shelters in Minneapolis. And I think probably growing up in San Antonio, you saw firsthand how living conditions could really make or break families. And so your authentic, really, connection to the human condition, I think, really distinguishes you. You do have the longest Wikipedia entry I've ever seen, by the way. I had to scroll 5 times on my screen just through the awards. You know, inducted into the Home Builder Hall of Fame, Housing Person of the Year, all of these recognitions and acknowledgments so deserve it. Your pursuit of the nation's toughest problems really distinguish you professionally, but like I said, I think it's your human connection to the people that live in these conditions that really sets you apart. I want to thank you for your help. I also want to personally thank you for the inspiration you've given our organization to expand our mission from children to older adults. Your book sits on my desk at work. It's a Bible, Independent for Life. It tells us about what you can practically do in homes to keep people in their homes longer, which is where our older adults want to stay. And we can do it. We know the things that need to be done. We need to just scale them up. So with that, I'd like to introduce Henry Cisneros. Thank you.
Rebecca, thank you very much. You said that you had some trepidation on introducing me. You can imagine the trepidation I feel on introducing the Secretary of HUD, because he follows me, but he is not here. So I'm going to be watching very carefully as Rebecca tells me, string it out, stretch it out. And if I speak very slowly, no, I expect he'll be here in a minute. It will be my pleasure at the end of my remarks to introduce the Secretary. But let me begin by thanking everyone associated with this effort. The National Committee on Housing and Health, the group of which I was a part, and the colleagues on it, a very distinguished group of people. The Technical Review Work Group that's already been mentioned, research and academic participants, the state and local government agencies, the federal representatives, and the non-governmental organizational participants. And let me thank the staff. I'd like to mention them by name because they've really done a good job. I've had a great privilege for a lot of years on working on a variety of task forces, as has my friend Bart Harvey, who is here. We've served together. But this is a very, very good team that was doing wonderful professional work, monitoring the research, keeping all of us involved, posted, and you can see by the final product that it represents some prodigious good work. The project manager was Jill Bracey, research director David Jacobs, policy director Jane Malone, and of course the executive director of the center, Rebecca Morley. Let's hear it for them and for their good work. Well, you've heard some of the sobering statistics about the health of our population and about our housing conditions. I think one of the important connections that this study makes is the connection between the built environment and the health of people. You've heard already in the last moments some of the statistics that speak to the connection between health and housing conditions, how about 20 to 30% of asthma cases are linked to home environmental conditions, how 21,000 cancer cases are traced to radon in housing, how over 24 million homes contain lead-based hazards yet today after all these years of working at it. And we know the implications in particular for children. And how home injuries are the leading cause of death among children. Home injuries, leading cause of death among children. And we now know as well the effects of falls for some 6 million adults who find themselves either in hospitals or nursing homes. My friend Paul Irving is here, I just noticed, from the Milken Institute, who's just conducted a major piece of work on the subject of elderly living in the cities and in housing and wanting to stay in place, and I'm sure understands the significance of all of this. As a former mayor, I remember the multiple conversations with fire departments about the hazards to first responders and safety personnel from the materials that are used in housing. Mr. Secretary, I was stringing this out. I look forward to introducing you in just a few moments. So the point is there are established connections between housing conditions and health. But one of the important things about this report is I think it takes us beyond just thinking about these matters as preventative, mitigating diseases or preventing injuries, but thinking about how housing can be a place where lives are enhanced, how we can turn homes into platforms where people are healthy for the long run, and in that respect, their lives are enhanced. We can make our homes smart, at least as smart as our phones. For example, carbon monoxide detectors can alert us to life-threatening situations. Modern, efficient ventilation systems can keep us comfortable, control humidity, provide clean, fresh air using new sustainable technologies. More resilient homes can help handle climate chaos, withstanding storms and wild swings in temperature with proper insulation, air sealing, structural integrity, and moisture control, and more. Building materials that speak to chemicals, plastics, formaldehyde, evolve with consideration of the human factors involved, as I mentioned a moment ago, for emergency workers. And highly impactful is the kind of settings we can create for an older population, 95% of whom, when polled, say they want to age in place, stay in their own homes. So the transformation of homes with grab bars and handrails and ample lighting and lower cabinets in homes and bathroom fixtures and connections to emergency medical systems and all kinds of things that are going to be possible going forward that make it realistically possible for people to live in their own homes and enhance their health, or at least sustain it on a more even plateau for a longer period of their lives. So these are the kinds of things that we can do that allow people to live healthily in homes. We know that to bring about our vision of ensuring that all people can live in safe and healthy homes, we need to marshal political and financial resources. Now, one mechanism by which we can do this is regulatory. And regulations are an important way to address unhealthy housing. We could also achieve this vision by arming the private sector with the right information. So in communities across the nation, we work with property owners, advocates, code officials, public health leaders, and others who are positioned to recognize and coordinate their shared missions of helping people be safe and healthy in the places where they live. We hope that the publication of this standard will inspire action and cross-sector collaboration in the private sector, at state and local levels of government, and we set forth the implementation of the standard in ways that will save lives, shrink disparities, and ensure our nation's homes as safe havens that they're meant to be. And then there is the role of the federal government. I'm glad that we're joined by Secretary Sean Donovan here today. I just had the privilege of co-chairing the Bipartisan Policy Center's 2013 report, Housing America's Future, New Directions for National Policy, and the report discussed HUD's role in maintaining the quality of our nation's housing. This is what the report said on that point, and I quote, "While HUD already measures housing quality in the public housing and multifamily assisted housing programs, very important, millions of lives are touched through various forms of subsidized and assisted housing, it will be important during the standard setting process to consider whether the current quality standard should be strengthened to better reflect the latest research on how housing promotes health, for example, with respect to ventilation, moisture, and pests." And it references peer-reviewed evidence by the National Center for Healthy Housing on housing interventions in health. So this was a way to state the importance of these standards in one other set of reports that speaks to how to stretch this across the country. We hope that the National Healthy Housing Standards will serve as a model for policy at HUD and its federal partners to adopt and promote to achieve the nation's healthy housing goals. As I look around this gathering of important partners in housing and health today, I hope that each of you will look within your own sphere of influence to think about how you can promote the adoption of the standard. That's a very important dimension of today's launch. Through housing finance, through housing codes, through housing rehabilitation, through green building and other ways, all of you have an important role to play. As some of you know, my day job is to raise capital and invest it in residential communities in urban areas across the country as chairman of CityView. CityView works with home builders, developers, construction professionals, municipal leaders, and redevelopment officials to build a broad range of housing project types. We invest in existing properties, new development, real estate mortgages, etc. That role puts me in position to work with many key organizations in the building sector, and I've promised Rebecca that I will work with many of those specific people that we work with and the extensions through national organizations to work on the standards implicit in this report. I've had conversations, for example, with the National Association of Home Builders, who will be really, truly important in trying to take these standards in voluntary ways and extend them constructively. And I served today on a task force organized by Mayor Bloomberg and former Secretary of Treasury Hank Paulson, speaking to climate change issues and their implications for business. My particular assignment is to look at the implications for the real estate and construction sector. And there are many implications in this standard for issues of climate change. And by the way, I had the opportunity to read not just the summary report that's in this packet, but the backup report that talks about stretch goals and talks about the scientific references, and it is very well done. This is a very, very important piece of work with important implications for the future of the housing sector. Well, as I said a moment ago, we are honored to have the Secretary of Housing and Urban Development with us today. Shaun Donovan is the 15th United States Secretary of HUD. He's devoted his entire career to ensuring access to safe, decent, and affordable housing, and has continued that work in the Obama administration. Secretary Donovan gets it, the fundamental truth that America's homes are the foundations for families, safe neighborhoods, good schools, and job creation, and as such, those homes need to be as safe as we can possibly make them, as healthy platforms as they can possibly be. Secretary Donovan's leadership at HUD has been impressive. Such things as the following: stabilizing the housing markets and working to keep responsible families in their homes through a very tough period for the housing sector. The agency has instituted reforms that have solidified the Federal Housing Administration's financial position and protected the taxpayer against risk while still preserving FHA's mission of providing responsible areas of home ownership. Together with Homeland Security, Secretary Janet Napolitano and her successor, he's led the President's long-term disaster working group composed of more than 20 federal agencies. The group worked closely with state and local communities, as well as experts and stakeholders from around the nation to create the National Disaster Recovery Framework published in 2011. Very, very important subject. We know that due to extreme weather events, as well as other things, earthquakes and other natural disasters, we are seeing more instances where the federal government has to respond on a large scale, from hurricanes in the east to floods in the Midwest to drought conditions in the west to fires that spawn fires to earthquakes in the far west. All across the country, at a moment's notice, the federal government, with the Secretary of Housing clearly in the forefront, has to play a role in making sure that people have a place to live. The Secretary has also been helping regions and communities develop comprehensive housing and transportation plans that create jobs and help American business, small businesses in particular, build communities. Secretary Donovan previously served as Commissioner of the New York City Department of Housing Preservation and Development. His work at HPD, a very important organization in the city, I think after HUD, it's the largest housing entity in the United States, included the New York City Acquisition Fund, an award-winning collaboration with foundations and banks to finance affordable housing, an innovative inclusionary zoning program, an ambitious supportive housing plan, and the Center for New York City Neighborhoods, one of the earliest responses to the foreclosure crisis. It's clear that the Secretary's work when he was in New York set the standard, and subsequent directors of housing in New York under Mayor Bloomberg and now Mayor de Blasio have taken that standard and worked from it, so that housing is now very clearly on the front burner of the Mayor of New York's priorities, as we have seen just this week in the announcements that were made there. So it is a very special pleasure to introduce a man who has been busy on the job at HUD, and in the years before that has prepared himself as a architect and public administrator to be in position to serve our country as the Secretary of Housing and Urban Development. Secretary Donovan.
Henry, thank you so much. A very kind introduction, but much more importantly, thank you for your leadership over so many years around the country. If I think about those 14 people who came before me in this job, Henry himself sets the standard. I think there is no question that if you did the consensus choice around the country for the best HUD secretary in history, Henry Cisneros would come out on top on that list. He certainly would come out on top of my list. So, and I really mean this. If I need a perspective on what I'm facing, the challenges, what I can do to do my part to move HUD and the country forward, Henry is the person I most look to for advice and guidance on those. You've been a remarkable friend and a mentor, Henry. Thank you. I also want to thank Dr. Vernon, Dr. Benjamin, Rebecca Morley for their distinguished leadership as well. And I finally want to thank everyone with the National Center, APHA, and all the friends and partners in the audience for your outstanding work in developing this National Healthy Housing Standard. As I was preparing my remarks for this afternoon, I thought about the old saying that, quote, "He who has health has hope, and he who has hope has everything." In other words, no matter who you are or what your background is, good health is essential to literally everything that we do. How we work, how we care for our families, how we contribute to our communities, and so much more. But the sad truth is that millions of families are seeing their hope for the future threatened by poor health. And too often, the cause is a place that should be sacred and safe for all of us, our homes. We've all seen how hazardous conditions can cause asthma or other respiratory illnesses, lead poisoning, and even cancer. Tragically, there are families that have to accept this fate because they simply can't afford to move. Take Philadelphia as just one example. Studies have shown that the 2 zip codes with the highest number of children living in poverty had asthma rates of 40 and 47%, respectively. The same can be said for cities across the country. And it's a shame that in 2014, millions of Americans are getting sick, not because of how they live, but because of where they live. We as a nation cannot stand on the sidelines and watch this continue. Instead, we've got to come together to protect the health and the hopes of families across the nation. That's what makes the Affordable Care Act so important. More than 8 million Americans have now signed up for coverage, for private health coverage, in addition to the millions more who've benefited by the expansion of Medicaid and the ability to stay on their parents' plans. I got a 14-year-old. He's going to be there pretty soon. This means that families will save on medical costs, freeing up the resources needed to move into a healthier community. It also means more families will be able to get care if they do get sick, in many cases preventing an illness from getting worse. So make no mistake, the Affordable Care Act is a game changer for all of us who care about health and housing. But as we all know, expanding coverage is just one part of the solution. We've also got to invest in preventing someone from getting sick in the first place, so that health hazards don't develop in the first place. That's what HUD's Office of Lead Hazard Control and Healthy Homes has been doing for years, and I want to recognize Matt and all the great work that he's been doing. We're out there providing funding that is unique to the federal government because it is focused on repairing homes to make them healthier and safer for families. Indeed, just this week, the office announced that communities can apply for $90 million in lead hazard control grants, and that is supplemented by $12 million that the communities can use for additional healthy homes testing and mitigation work. We're also developing research that results in evidence-based strategies that we know work, empowering local leaders with the tools they need to make a difference in their communities, promoting smoke-free policies, and I want to recognize this. We have Sunya here and others from the public housing community, promoting smoke-free policies where over 450 public housing agencies have now gone smoke-free. Really a remarkable transformation in public housing. We're also partnering with HUD's Office of Multifamily Housing to require testing for radon during multifamily housing financing or refinancing actions. And we're collaborating with several federal agencies to develop and issue the Federal Radon Action Plan and the Federal Asthma Disparities Action Plan. Not only is this work good for the health of our families, it's also good for the health of our economy. A Pew report found that for every dollar that we invest in lead abatement efforts, we return at least $17 in savings for taxpayers. So these efforts are both good for the common good and the bottom line. Now, obviously, all of us at HUD are proud of this work, but we know that to solve these big challenges, we cannot do this work alone. That's why last year we were proud to join with other federal agencies to launch a comprehensive strategy to advance healthy housing. It is recognition that HUD, EPA, HHS, and other partners all have a role to play in this work. And rather than address them in silos, we're at our most effective when we're working side by side every step of the way. In addition, we want to continue to work with academic, nonprofit, and other partners like so many of you that are in this room today. That's why HUD is holding a National Healthy Homes Conference in Nashville starting on May 28th. A wide variety of groups will be coming together to exchange ideas and experiences and ultimately to establish new ways of working together. I invite every one of you, in fact, I expect every one of you to join us, and I look forward to seeing you in Nashville. As much as anyone, you understand the importance of collaboration in meeting our shared goals. In fact, it's the power of our partnerships that brings us together here today. I know that technical experts from all levels of government, academia, for-profit and nonprofit organizations help develop the National Healthy Housing Standard. And I want to thank every single one of you. You've identified a strategic balance between feasibility and stringency. Now, obviously, if you make a standard too lax, it doesn't protect residents adequately. But if you make a standard too stringent, and it's unlikely to gain acceptance by key stakeholders, more than likely it will just sit on a shelf somewhere. You've done, I think, a terrific job of striking the right balance so that we will really move our nation's housing forward. Furthermore, the standard doesn't just settle for identifying minimum requirements for healthy housing. So often you set a single standard, and that's where everyone gravitates to. Rather, as Rebecca's noted, we provide flexibility with stretch provisions for owners and managers who have an interest and the means to go even further than those minimum standards. This approach acknowledges the range of financial and liability concerns that different owners and managers confront, while providing a clear framework for encouraging additional protection for residents. Another specific piece of this I want to point out is that it's written in language that people can understand. That means that builders, inspectors, property managers, so many others in the housing industry can easily digest this, and again, makes it more likely that it will be accepted and become the standard everywhere. It'll allow local jurisdictions that want to adopt some or all of its provisions to do so easily. If they need to adjust a provision to the standard, a provision of the standard to harmonize it with their existing local codes, the way you've written the standard will make that easier through easier editing. In total, the National Healthy Housing Standard is a critically important tool to get us closer to the goal of having safe and affordable housing for every American. The standard provides an operational definition of a healthy home that's feasible to attain without placing undue cost or burden on property owners. It uses the best available evidence to supplement existing codes, making it relatively easy to implement. And I assure you that HUD is going to look at it in every place it can with respect to our own operations. This work is a top priority for us. That's because, to use that saying again, he who has health has hope, and he who has hope has everything. No child should lose hope because their home has them spending time in emergency rooms rather than classrooms. No parent should lose hope because their home forced them to miss work when they got sick or injured. No family should lose their hope because they can't afford to move to housing that is free from hazards. We as a nation can and must do better. Working together, I know we will. Thank you.
Wow, that was terrific. Thank God for smartphones. I think the conference attendance just spiked with your remarks, so that's great. We really appreciate your being here. That was terrific. That concludes our program. I want to invite everyone to help yourselves to some dessert and some coffee, and please continue networking. I would like to ask our board members and the folks that worked on our 2 committees to just join us very briefly for a picture up front. And once again, thank you both to all of our terrific speakers today, and especially to the Secretary for taking time on your schedule to be here, and to Henry as well. Thank you.